Coming up next is Dr. Kimberly Taylor. You can listen live on the internet at drkimtaylorshow.com. Here now is Dr. Kimberly Taylor.
Welcome to the program. I'm Dr. Kim Taylor, and we are going to be talking about eating disorders. And I'm really happy to have two experts in the studio today to talk about the major kinds of eating disorders. We're also going to talk about what causes them, how to recognize them if you or a loved one has this, and who is most likely to be the ones that are prone to this. And then in the end, we're also going to be talking about what are the treatment options and how do you go about finding help or getting help, and what are the steps that you might need to take. So I want to welcome and to tell you about my two guests here. The first one is Judy Bruton, and she has a law and social work degree. She practiced law as a criminal prosecutor and a corporate trial attorney for many years before she became a therapist. She's worked for several years in the field of eating disorders, and she actually co-founded a nonprofit organization dedicated to raising awareness of the complexity of eating disorders, and has actually held workshops and taught classes for a lot of therapists. She currently has a private practice in Santa Barbara, and she does some teaching and consulting in the fields of law, ethics, and leadership, and she holds a job also as a special assistant to the president at Antioch University here. And then our second guest is Linda Wells, and she has a bachelor's degree in sociology with an emphasis in psychology. She got her master's of social work, and she's worked for several years as a therapist and consultant with adolescent girls ages 12 to 18. This has also been, it sounds like, in some group home settings, and she's also provided parent education training to the staff and interns and parents. She was hired as the clinical director of the Child Abuse Listening and Mediation, and she was responsible for the supervision of a lot of the services there. Currently, she's in private practice. This is the field that she actually specializes in, and she's currently the owner of Eating Disorder Center of Santa Barbara. So I'd like to welcome you both. As a way to get started, Judy, why don't you just start out letting us know what is a eating disorder and what are the major kinds?
Okay. First of all, I want to say thank you, Kim, for inviting us to your show today. Eating disorders are very complex and subject to a lot of public discussion today, which in many ways I think is a very good thing, because I think that the more awareness that we have as a community about the complexity of these illnesses, the better. But there's also a lot of misinformation and myths surrounding these illnesses. So any opportunity that we have to talk publicly about them, I think, is a really healthy and good thing.
Absolutely.
Eating disorders versus disordered eating is sort of a spectrum issue that I think we'll be talking a lot about today. But eating disorders are defined medically. As therapists, we work with these definitions, and they're technical. But I think that the common understanding of eating disorders, the eating disorders that most of us hear about, are anorexia nervosa, commonly just called anorexia, bulimia nervosa, binge eating disorders, and now we have a recognized exercise disorder as a fourth category. Anorexia is characterized most clearly by starvation and excessive weight loss. The symptoms can include a refusal to or an inability to maintain body weight at or above a minimally normal weight for one's height, body type, age, and activity level. It's often combined with an intense fear of weight gain, or getting what we call fat, a feeling of being fat or overweight despite one's actual body weight,
Okay, so it's very distorted about what they see versus what other people see.
Exactly.
Okay.
And extreme concern with body weight and shape as well.
Okay.
Bulimia is characterized by what is usually a secretive cycle of binge eating followed by purging. And bulimics generally tend to consume what the average person would consider to be a large amount of food, but not necessarily when they're eating in public.
So it's something that they can very much do in private, and for the most part, they try and hide it.
Exactly. There's a
Okay.
lot of shame associated with all of these illnesses.
Okay.
And the way that they can purge is not just what we would think of as vomiting as the most common way, but people often use laxatives. They will exercise to the point of purging, using up all the calories that they've eaten. Or there are other ways to get rid of the food that one can think of too. And again, the symptoms would be repeated episodes of binging and purging, feeling out of control during a binge, and eating beyond the point of feeling comfortable, or being able to recognize what your body's telling you in terms of feeling of fullness or being satiated. Purging after a binge, typically using the kinds of methods that I've talked about, or maybe
Right.
diet pills. And then frequent dieting. So these could be your yo-yo dieters, as well as excessive concern with body weight and shape.
Okay.
And then binge eating disorders or compulsive overeating is pretty well self-defined by the term.
So, Linda, who is it that actually develops these kinds of disorders that really start to have a problem with it? Is there a common profile?
Well, historically, we tended to believe that young girls and young women were the primary candidates for developing an eating disorder, specifically anorexia or bulimia, with a concern for weight and shape and preoccupation with that. But we're seeing a rise in either diagnosis and or actual rise in the number of men, older women, and boys developing these same disorders. And we feel that the reason for that has a lot to do with the fact that our culture and media is putting more and more emphasis on weight and shape as a desirable characteristic, sometimes to the exclusion of other desirable things like strength or athleticism, etc.
Right. So this whole need to be thin and thinner and the thinnest is really a part of this process too.
That's right.
Okay. So what kinds of things do you see play a role with that? Is it mostly movies and TV and celebrities?
Movies, a focus in magazines, a change culturally. Back in the 60s, Miss America weighed approximately 15 to 30 pounds more than she does today. So we see that the norm has become inappropriate. The standard image that we see in the media and in magazines and in movies is not the average size woman or man. And young girls and boys are very much influenced by that.
Okay.
In addition, I just want to add, I think that what Linda's saying is accurate. I think that as we, as a society, also live longer, there is this quest for eternal youth. And part of what is defined as being youthful has to do with our body shape and size, as well as our general appearance. So, again, this you can't be too thin to be equating thinness with happiness or success.
Right.
I think kind of permeates not just our youth, but our entire culture.
Right. I think that old saying that you can't be too rich or too thin comes to mind. That
Exactly.
People really follow that, and people really feel that unless they are thin, that they're not going to be loved, they're not going to be accepted, and that is the model that they need to fit in order to fit within their friendships or to get the right roles or the right job or to get the right partner.
Right. But at the same time, I also want to just throw in that I think that it's, again, much more complex than that, and that is not the cause in every instance. It's not how they always begin, or it's not necessarily true that that's the only reason why there's a rise today.
Okay, so we are just going to take a brief break. We are here with Judy Bruton and Linda Wells, and we're talking about eating disorders. We will be right back after the break. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. Hi, we're back, and we're here with Judy Bruton and Linda Wells, and we're talking about eating disorders. What I want to let you know also is that you can listen to this show as a rebroadcast Thursday evenings at 10 p.m. and Sundays at noon. So to kind of get back to this, I think one of the questions that we need to ask is how common is this, and who actually is at risk?
That's a really good question, Kim, and I think it's that any statistics that I could give you, you need to understand that part of these disorders that is particularly tricky to talk about is that there's still a lot of shame associated with this illness, and we can talk more about it. But as a result, we know that there is gross underreporting in the field, and we also know that it's only been within the last 20 years or so, maybe 30, that it's been recognized as a defined illness that people are seeking treatment on and getting trained as specialists in. So in terms of tracking it, that's a relatively new phenomenon. But we recognize, and you can see it in the literature, a lot of people go back to Little Women and look at what Amy, I think it was, suffered from, and look at the symptoms, and there's speculation that what they were really talking about and describing was anorexia.
Okay.
So it's not a new development, but even given that underreporting, it's estimated that, and these statistics were put together by the National Eating Disorders Association some years ago, and at that time, almost 10 years ago, they were saying that 10 million American females, 1 million American men had eating disorders.
Really?
And we know that the illnesses are on the rise.
Do you both have a rise in cases that you actually see or get calls about? Do you see more and more of a rise with that?
Yes. I have a lot more men on my caseload. I have a lot more children. And I have, I'd say 50% of my caseload are adult women over the age of 40.
Okay. So, Judy, sorry, go.
No, that's okay.
Yeah.
So they're thinking that about 10% of all cases today are men, and it sounds like you might be seeing even more of that in your practice, Linda. Anorexia is ranked as the third most common chronic illness among adolescent females in the United States. Okay, for females between the ages of 15 to 24 with anorexia, the mortality or death rate is 12 times higher than all other causes for that group. Okay, and
so we're talking about a very serious issue, especially if it goes untreated.
Exactly.
Okay.
And especially, the population that is really, really vulnerable are those people who, when you're talking about young children or adolescents who are in a point in their life where they need to be growing, where their bones are still developing.
Their bones,
their
and
brain,
mind
and
everything. Yes,
exactly. Think about starving those organs and what happens. It has lifelong consequences, and also they can go from relatively healthy to very, very, very seriously ill in a very short period of time. So that's why it's so insidious, and it's really important that if you think that your child or someone that you love is may be suffering from this illness, that you seek professional help as early as you possibly can. You know, for a long time, anorexia was defined as you weren't considered anorexic from a medical standpoint until you reached a certain low threshold of, a certain percentage of normal weight. And one of the problems with that type of a definition, which I'm happy to say is not now the case, is that that's like saying you don't have cancer until you're in stage 4 and don't come and seek treatment until there's no cure.
Right, and that's part of the reason why I think this program is so important, is that people, first off, to take the shame out from it, but then to really start to look at the signs that people might need to know that this could be leading toward that you may be in, let's say, stage 1 and not know it. And this program is really designed to get people to know and to be more clear about that so that they can start the conversation about it. So, maybe what we should talk about next is what are the common signs? What are the symptoms that people should be really looking at and focusing on and taking in a very serious way?
Well, as Judy highlighted, there is a lot of shame and secrecy around eating disorders. So it really requires that loved ones are really looking carefully to make sure that their child or teenager or even young adult or even partner
Or parent.
or parent are exhibiting appropriate behaviors in relationship to food and weight and shape. And so there's a subtlety that often results in diagnoses being made very late, and which means recovery is that much harder. So one of the things you'll see almost consistently is a pursuit for thinness or preoccupation with weight and shape, an over-concern with calories and how much is or what is in a certain food, restrictive thinking and behaviors concerning food. It might be, I don't eat after 7 o'clock, or I avoid bread or any kind of carbohydrate.
Okay,
That's
now
kind of a
this
common
I think
example.
is a really big point. Talk more about the different kinds of things that parents or friends or family might really start to tune into. A few that you just pointed out, but what are the other ones? Let's kind of round that out, because I think this is a main point to help people to recognize it. What else? What other kind of restrictive behaviors?
Well, you often would see behaviors like isolation, irritability, a lot of anger, a lot of shame, a lot of denial when asked about it. Because
so they argue it, say, no, I'm fine. I ate. I already had something.
Exactly,
Okay.
and part of it that makes this so tricky is that at the same time that an individual may be becoming sicker and sicker, and I'm saying that in quotes, they are also getting, at least for a while, really positive feedback.
Right, and reinforcement.
And
for
reinforcement
weight loss.
for weight loss, probably from their peers and maybe even from their loved ones. So, the illness can end up feeding their ego at the same time that their loved ones are becoming potentially more and more aware and more concerned. So to acknowledge that it's a problem or that it's out of control can mean having to totally, reshape what they've now built up to be a point of pride and really begun to define themselves by, and get some pretty strong support from other sources.
Right, and wouldn't it be true that in some cases that the reason that they even start out into this is to seek attention? And so when they start to get this positive kinds of attention for the weight loss, it starts to feel good, because to start out, there was something missing in their life, whether it was not receiving love from others or not feeling like others liked them. That they could start out for those reasons too. So it's like a real negative feedback loop
Well,
here.
there are lots of reasons beyond a pursuit for thinness, which is a classic one with anorexia, that somebody might develop an eating disorder. It might be a sense of control. Let's say they've lost a loved one and their lives feel out of control. Controlling food and, as Judy pointed out, the attention that comes from that,
The positive
might feel
reinforcement.
like a way of resuming some kind of control. Also, a sense of identity. If somebody's feeling sort of a void, or they're dealing with depression and anxiety, which is really common as well, that sense of control that comes from a sense of superiority, or once again, attention, receiving attention for a weight loss. And sometimes it may be a comment that a coach or a teacher made, or a boyfriend made, that promoted a feeling, I need to lose weight, and now that I'm losing weight, I'm pretty good at this, and I'd like to continue. And so going to a child or a teenager and saying you're getting too skinny actually reinforces the disorder, as Judy was pointing out.
Okay. Yes, Judy.
Well, I was just going to say, but I also think that what we're talking about is very much of a stereotype too, and that there can be lots of other ways that this can start. So, like, I've worked with patients who, as children, were diagnosed as diabetic, for example, and they have a real need, and the family has a real need to focus on food and to focus on body and to focus on health. And what may start out as a way to cope with another medical problem that is very real can morph into an eating disorder at some point.
Okay.
There can be, and you know, we were talking about restricting things like bread. Well, you know, celiac disease is a very common, not very common, but a more common illness today. Or, you know, a lot of people are talking about gluten-free and all of that. And, you know, I worked with a patient who had a very complex situation that, again, started with diabetes and became more complicated. That becomes a very difficult thing to unravel.
Okay.
Yeah.
And I think that we will come back to that we're going to be that we should talk about what are the actual symptoms. Okay, but we're up with a break here, and this is Dr. Kim Taylor, and we will be right back with our two guests. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. Okay, we're back, and I just want to make a note that you can hear this in a rebroadcast Thursday evenings at 10 p.m. and Sundays at noon. But for right now, we are in a studio with Judy Bruton and Linda Wells, both who have a vast experience with eating disorders, and we are talking about right now what are the key warning signs that if, in fact, you could just give point by point by point, what are the important things that parents or loved ones should look for if they have any thought that their child or friend or family member might be involved in something like this?
Well, as we said before, a preoccupation with weight and shape is often a factor. Concerns with calories and what's in certain foods. There's also some behavioral things to look for, and that includes eliminating certain food groups altogether from one's diet, or developing interesting or unusual food rituals. For instance, putting mustard on everything or eating tiny, tiny little bites are sort of classic and sometimes subtle behavioral changes you might note. Also denying hunger altogether, eating in isolation, leaving the room to use the restroom could indicate a bulimic issue. And also looking for, you might be aware of wrappers that one might find in the trash can that would point to the use of diuretics, or laxatives, hiding food bills, using restrooms again after eating in restaurants immediately. Things that sort of draw some attention could be a red flag indicating maybe there's something to look into here.
If I can just add, because it was so surprising to me when I started to work in this field, but another thing that I think is pretty well known professionally that may be surprising to our listeners is that frequently people who are suffering from anorexia or one of the anorexia in particular, they're obsessed with food. So like their favorite show on TV might
Maybe
be
a cooking
cooking show.
Really?
And,
Okay.
I mean, at the inpatient treatment center that I worked at, it was clearly the favorite channel in the house, and we would have to, control that, monitor that. And oftentimes, these people become great chefs even. They love to prepare meals for others, and then they deny themselves.
Okay.
So don't, to say that your loved one loves to cook, loves food, is always talking about food does not necessarily mean that there's not something wrong.
Okay. All right. Good. And also, if they are very involved in food, some of the other symptoms may apply because they may be depriving themselves.
That's right.
Okay. So what are some of the consequences of eating disorders psychologically and with just their physical health? What actually happens?
It's a very complex system. Our bodies are very complex, and I guess before I get into this, the one other thing that I do want to say is that again we're kind of generalizing and stereotyping. So just because somebody is very thin, or just because somebody is maybe even malnourished, does not necessarily mean that they're anorexic. There can be other medical reasons for someone's extreme weight loss. So what we're really trying to say here is that if you have any thought that there may be a problem, you need to get a complete medical workup and evaluation by an expert treatment team, because it could be something very, very different than what we're talking about here today. And I started to mention, the young woman that I was thinking of who started with diabetes as a child. She developed anorexia and was in a treatment center, but every time she ate, she had terrible pain. Well, it became very complex to figure out whether the pain was, caused by the fact that she was fighting against, eating because of the anorexia, or something else was going on. We eventually learned that she had celiac disease, so a lot of the food that she was being fed was painful for her to eat. So
it's really important to weed it out, to get involved with experts who can really start to look at exactly what is going on.
That's
and
right.
to trace it
That's
down.
right.
Get an assessment either way. You need to
Okay.
rule out medical concerns beyond an eating disorder, but you also need to fully assess for an eating disorder.
That's
both
right.
medically and clinically.
And is it also true that other kinds of things can be involved, whether it's depression, anxiety, or substance abuse, that this also can mask it and or be a part of the problem?
Yes.
absolutely.
Okay.
Yeah, absolutely. And I guess the other piece of it is not, and I want to get to what are the other physical symptoms and damage that can occur as a result of anorexia or bulimia, but also to recognize that there can be many what we would consider comorbid or coexisting psychological issues too, such as anxiety, depression, addiction, et cetera, et cetera.
Obsessive compulsive disorder.
Right.
Okay. All right. Was there something that you wanted to add with
Well,
this?
I was going to talk about the effect of starvation or of bulimia, constant binging and purging on your organs. And, not only does it affect your brain, because your brain needs food to stay healthy and functioning. One of the first organs to start to shut down when you starve yourself is your brain. And permanent brain damage can in fact occur. But it can affect your vision. Bulimia is known to destroy your teeth because the enamel can get worn down. Your hair can become brittle, fall out, frequently with anorexia. You can have hair problems. Bulimia, you develop serious glandular problems. You can have ulcers, you can have heart problems, you can have serious bone problems. It can affect your kidneys to the point where they shut down, stomach problems, colon problems, muscle loss and weakness. So
pretty serious issues.
It can cause
arise.
death.
Okay. All right. Well, and that I think should be said again. It can cause death.
Yes.
Okay. So we are going to be taking a break again, but when we come back, we're going to be talking about the treatment options. We're also going to be talking about what maybe parents and schools can do to help to prevent this. And we're going to talk about how do you go about finding someone who can help you, whether that's a eating disorder treatment center or just the kinds of resources that are out there for help. This is Dr. Kimberly Taylor, and we'll be right back. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. This is Kim Taylor, and we're joined here today with Judy Bruton and Linda Wells, both leading experts here in this field of eating disorders. We're now going to really shift gears and start to focus on what are the nuts and bolts of treatment. What are the options that are out there? When does someone seek this treatment? And what can parents and loved ones do to help those that they know are suffering from this get the help that they need?
Well, really the first step is to seek an expert to help evaluate the situation. And a really positive approach with a loved one goes a lot further than an argumentative or accusative one. So indicating I'm concerned, let's look together for resources for you. And let's get you some support and help so you can see if there is an issue and how you want to work with it is a really helpful approach. Finding an expert in eating disorder as a therapist who specializes specifically in that is really ideal.
And how would one start that process? I mean, besides going to Google, what else can they do? Is there a system?
Well, there is actually an excellent referral resource. It's called the eatingdisorderreferral.com. And that is a list for every community of therapists that identify as specialists in the eating disorder field. So that's a Google website that is worthwhile to Google and to also speak with people in the community, say doctors, nurses, coaches possibly, school nurses who may be aware of local experts in the field. And maybe interviewing one or two or three is ideal as well. Hopefully that person is going to be able to do a thorough assessment and help determine where this person's status is. Sometimes people are going to really need a higher level of care pretty immediately.
So that will probably and most likely be inpatient?
Possibly.
Is that what you're talking about?
Residential or hospital, depending on insurance and also their medical status. But there's many steps prior to that. We now have day treatment and intensive outpatient programs in most communities that are sometimes the initial step if somebody needs something beyond individual counseling and work with a dietitian.
Okay, but part of going for that first assessment would really point out what the next step would be and what the next step, whether it would be just an outpatient or a day treatment or a residential.
Yes, and lots of times somebody will work with an individual therapist, and after a while it becomes evident that they're not making progress, and then ideally that person's going to have a treatment team in place to help further assess, including medically, and a referral can be made to a higher level of care, and then that individual can step back down into their community, back to their community, and receive either intensive day treatment or an intensive outpatient program, which is several hours, several times a week, but not a full day, and or simply an eating disorder team that they work with typically at least a year and lots of times several years to make sure that they maintain their recovery.
Okay, and I would assume also with all of this that there's going to be a huge family portion of this, family
Yes.
therapy, getting the family involved, helping the family to deal with this problem too, because it's not just a child's problem or one person's problem, but the rest of the support team can also be gathered to help and to teach them how to work with this person and how to help this person
Yeah.
and be part of their support system.
Yes, it's really ideal to bring in loved ones, and that might be, depending on somebody's age, for an adult woman, she may be more interested in having her partner come in. A child, almost always, there's intensive family therapy involved. So the support system is key, and the therapy can help support the person supporting the individual, and that can go a long way to having everybody on the same same page, and not expecting too much progress too fast. That can be an issue that can derail patients. So we want everybody supporting a long-term recovery process.
One of the things that I think is important to point out is that to get an assessment from a professional team is sort of like the best news you can find out is that it's not an eating disorder, and that what's happening is within the spectrum of normal, and there's not an issue, and that can be the way that the evaluation comes out. So it's the same way as you feel a lump in your breast. Some people might go into denial and just not deal with it, and they may end up with that stage 4 cancer. On the other hand, other people, when they feel a lump in the breast, go right to the doctor. They can have a test performed and find out that it's a benign cyst, and nothing further needs to be done. So there's a range of possibilities. So when parents or loved ones start to talk with someone about getting an evaluation, I think it's important for them to not become defensive and not get into an argument about it, but to point out that if the person is certain that nothing is wrong, that's a possible outcome of the evaluation that might happen, and to allow the professionals to come in and make that evaluation as opposed to it becoming an argument between parent and child or spouses.
And I think it is important to not give in or deny that if there does appear to be an issue, to keep pushing to get help, much like you would with a loved one that has cancer. You want to make sure that treatment really is occurring. And sometimes people with eating disorders have strong wills, and they may be very adept at sort of denying the need. And it's really important that they do seek treatment. And the therapist can take over from there, and the parents can go back to being parents, and loved ones can go back to being loved ones. And it takes a lot of stress off the family to find a professional that really can help.
The other important point that I want to make, Kim, before we move on, is that early treatment equals greater success. There's not a lot that we know in terms of hard evidence, but we do know that. So if everybody could take one thing away, it would be that message that the sooner you deal with the problem, the greater the likelihood of a successful outcome you'll have.
That's a very good point. And I also think think about that it isn't about the food. Food is not the problem. It is about how they are seeing it and how they use it, because this does affect them on a psychological level, medical level, physical level. And so by going into treatment, they can address all the reasons why they got into this and what is underlying it, which I would think would be one of the most important parts, to really feel enlightened about why did this happen, what might we need to do to change that, so that they don't have to go about doing something to numb their feelings and or to deny what it is that's actually going on. So it helps to bring the problem up, and so that the problem or the base of the problem can really be resolved. Do you have any other thoughts about what parents or teachers or friends, what we can all do to help to prevent some of this from going on?
Yeah. I think one of the things that I do want to say is that I think for a long time, parents were, particularly mothers, I think a long time ago, were sort of viewed as causing the problem.
Yes.
And no one believes that to be the case, I think, anymore. When we talk about bringing the family into treatment today, what we're talking about is educating everyone about the illness so that everybody can be on the same page addressing it going forward. The same as if a child has asthma, you want to teach the parents and the child about the illness so that they have a greater chance of recovery. So I think that there's a lot to be done with families, and there's a lot to be done with education all the way across the board.
So in answer to your question, creating a positive food-friendly environment with a healthy emphasis on health over weight and size is something that families can do. Focusing on positive versus negative self-talk about one's own weight, let alone children's. Helping family members of different sizes develop their own positive body image, and trying to have a balanced approach within the family, and role modeling that by the parents can go a long way to creating a less likely scenario for somebody developing an eating disorder.
Okay, great. We are going to take our last break here, and then we're going to come back, and we're actually going to talk about how they can also reach you out there, and to give your phone numbers and website numbers. So this is Dr. Kim Taylor, and we'll be right back. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. This is Kim Taylor, and I really want to thank Judy Booten and Linda Wells for coming in to really share their vast wealth of information with us. There's so much to talk about here, but as always, we're against the clock, so I really hope that both of you can come back and talk more about this. What we have certainly learned here is that eating disorders can severely impair people's functioning and health, but for the most part, that when people seek help and when they do it soon, and that they seek that help from the appropriate therapists and professionals, that their eating disorder has a really good chance of having a good prognosis, that they can recover from this. So if you have questions or if you would like to seek their expertise, Judy Bruton has a private practice here in Santa Barbara. She can be reached for a confidential consultation. What is your phone number, Judy? What's the best one for them to reach you?
805-689-1677.
Okay. Linda Wells, she heads up the Eating Disorder Center of Santa Barbara, and she can be reached for a confidential consult by calling what number?
805-965-1651.
Okay.
I can also be reached through my website, Linda Wells, LCSW, or through the Eating Disorder Center of Santa Barbara, LLC.
Okay. And just in the closing, is there any piece of information that you feel like we have left out that you really want them to know?
That eating disorders are treatable. There's a wonderful prognosis for people that are willing to do the work, and life can change, and there's a silver lining in a sense of community and overall mental health that can be acquired if somebody's willing to take the steps and get treatment from supportive resources.
Okay, that's a really positive way to think about this. Judy, was there anything else that you wanted to add?
I think the only piece is that I think that it's very important to seek treatment from people who are experienced in the field and to expect a treatment team approach.
Okay. Thank you both for being here. I think this has been a really good day to kind of get all of that info out there and to help people. I'm your host, Dr. Kimberly Taylor, and I will be back with you next Thursday and every Thursday between 2 and 3 p.m., where you can call in with whatever is on your mind. You can also reach me with your email questions by going to Dr. Kim at drkimtaylorshow.com. And then don't forget to hear the rebroadcast of this and every show on Thursday evenings at 10 p.m. and Sundays at noon. You can also listen to the program on the internet by going to my website at drkimtaylorshow.com. I'm Dr. Kimberly Taylor, and I look forward to taking your calls next Thursday afternoon, where I will be here to help you solve your life problems. This is KZSB AM 1290, the News Press radio station.